Hi, I'm Nurse Luther. I'll be taking care of you today. Can you verify your name and date of birth?
Wade Hambrick, 12/02/1998.
Okay. Privacy and proper hand hygiene. So today we're going to start with a cardiac assessment.
Okay.
So first I'll listen to some sounds
Okay.
for your heart. Okay.
Okay.
Start here. Alright, sounds good. Now we're going to check your capillary refill.
Okay.
1, 2, 3. Okay. 1, 2, 3. Alright, and now I'm going to check you for edema. So I'm going to press down a little. That's good. Alright, now I'm going to feel your radial pulse. Okay. Alright, now I'm going to check your legs and feet. Okay, so first we'll check for edema. So with this, he would not have socks or pants or on, so I could see his skin.
Yeah.
Alright, and then I'm going to do your pulses down here. So your dorsalis pedis, top of your foot. Okay, and then your posterior tibial, behind your ankle. Alright, all that looks good. Have you been having any issues with your heart or chest, any chest pain at all? Okay.
No.
Okay, now we're going to do your respiratory assessment.
Okay.
So I'm going to listen to some sounds, and this would be done without a top on so you could hear better, and there wouldn't be any interference. Okay, so you're just going to take a deep breath for me. Okay. Now, I'm going to have you put this arm on that shoulder. Deep breath. Okay, same thing with this arm. Alright, now I'm going to check your back. Please hold for me. Deep breath. Alright, well that's sounding good. Have you been having any kind of cough or any shortness of breath or anything like that? Okay. So two things I'm going to have you do. One is going to be an incentive spirometer. So we'll pretend like this is our incentive spirometer. So what you're going to do is breathe in for about 3 to 5 seconds. You're going to do this 10 times an hour. So if you can demonstrate what I just told you. Okay? And then another thing is going to be to turn and take a deep breath and then cough.
Okay.
Both of these are going to help kind of move mucus around.
Okay.
With the turn and the deep breath and the cough, you're going to do this every hour. So if you're on your left side, every hour you're going to turn to your right and then
Okay.
turn, take a deep breath, cough out all the
Right.
mucus. Okay. So I'm going to ask you a few questions. What year is it?
2023.
Okay, who is the president?
Joe Biden.
Okay, where are you right now?
In your house.
Okay, and what's your full name?
Logan Wade Hambrick.
Okay, so the patient is oriented. So now, is it okay if I touch your face?
Yeah.
Alright, we're gonna feel for some lesions. Alright, everything feels good. Now we're gonna check your ears. So, symmetrical, we're gonna check your hearing, so I'm gonna go behind you and just repeat what you hear.
Apple. Orange.
Okay. So, now we're gonna check your eyes.
Okay.
Alright, so your pupils right now are at about a 6. Open fully. Okay, we got down to about a 3. Alright. Okay. Now I'm gonna have you look here at the pen. Okay, now look at the wall behind me. Alright, looks good. Okay, so have you been having any headaches or anything like that recently?
No.
Okay, any ringing in your ears?
No.
Any trouble seeing?
Mm-hmm.
Okay, now we're gonna check your nose.
Okay.
So everything looks symmetrical. Okay, can you breathe in for me? Right. Any trouble with that?
Just kind of nasally.
Okay, so kind of stuffy.
Yeah.
Alright, so is that the only kind of thing that's been going on with your
Yeah.
nose recently? Feeling stuffy?
Just allergies.
Okay. Alright, now we're gonna do your mouth. Can you take your tongue out for me? Alright, smile. Okay, and then can you swallow for me? Okay. And have you been having any throat pain, any trouble swallowing, anything like that?
No.
Okay. So now I'm gonna have you come to me and move the chair out of the way, and then walk straight back to that nice stand.
Okay.
Okay, and then now walk to me heel to toe and look up if you can. Perfect. Alright. Now I'm going to have you put your arms out wide, and then I'm going to have my hands here just for stability purposes, and then feet together and close your eyes for me. Alright, no swaying is present. You can have a seat. And then the Glasgow-Coma scale. He's obviously oriented, and all his head, eyes, ear structures, all that is good. So he would get a 15. Now we're gonna do your musculoskeletal system. So we'll start with your upper extremities. Alright, so I'm feeling here for any crackling or anything like that in the bone, so if you could flex that arm for me. Okay, now extend. Alright, now we're going to check your muscle tone, so flex. Alright, extend. Good. Now we're going to do your wrist. Turn this way. Okay, flex your wrist for me. Okay, extend and hyperextend. Alright, flex. Okay, extend, hyperextend. Alright, good. We'll check this arm. Okay, flex that arm for me. Good, extend. Okay, push up on my arm and flex. Alright, extend. Okay, we'll do it with this wrist. Flex, extend, hyperextend. Alright, now push down on my hand. Push up. Okay, now we'll check your lower extremities. So we'll start with your knee. So extend it for me. Okay, flex. Alright, now push up on my hand. Okay, down. Alright, and then we'll do your ankle. So if you can do the plantar flexion, push down and up. Okay. Extend, flex. Push up on my hand. Alright, push down. Okay, good. And then if you can do the plantar flexion, push down. Alright, push up. Okay, everything looks good and sounds good.
Cool.
So I'll document my findings and your provider will be right with you.
Okay.
Okay, proper hand hygiene.